respected dignitaries on the stage, dear friends. Today, I want to welcome each one of you here for the heart dialogue, to listen for your heart. So, without wasting much time, let me get into my duty, that is welcoming each and everyone who has come here. So, I want to thank and welcome our Honorable Director, Professor Shivaji Chakrabarty, who gives us the inspiration and who makes it a point to be there for us whenever we conduct every program. So we are really grateful and thankful for coming. The next person who is instrumental in the conduct of this event is the CEO of Aster MIMS, Dr. Salman Salahudheen. So I met her and she was very kind and very enthusiastically agreed to send her team as well as to come here. She's a charismatic leader, and as you know, Aster MIMS is one of the leading hospitals in Northern Malabar, and we really thank her for taking the time for coming here and gracing this occasion. We welcome you, ma'am, on behalf of the NITC. Our Honorable Registrar, Lieutenant Colonel Congratulation Sir, is part of the NITC Health Center team. But still, when he was in the meeting where we decided for all these activities, so I would like to welcome him into this meeting. So we had an additional guest we have a team from NITC, Aster MIMS. We were expecting 3 cardiologists, but as they are going to prove that heart is the organ which we cannot believe, like when it will have a problem, we don't know. So out of the 3 doctors, one of the 3 doctors got stuck with an emergency. But today we have here Dr. Salman and Dr.Sudeep Koshy. So it is my pleasure to welcome Dr. Salman and Dr. Sudeep Koshy. So, incidentally, as many of you know, he is my husband, and he frightens me with a lot of stories and with making me makes his work, because we are 2 people married with different professions. We have a lot to talk, and he talks more about heart, and that is why you are all here to listen about the heart. I also want to thank Mr. Anwar Hussain. He's the head of business development in MIMS. We didn't know that he was coming, and we really appreciate you coming all over here. So he was the second person we discussed with. Thank you, sir, for coming. And we have a team from MIMS. We have Nisha, we have Dr. Fias, and we have a couple of more people who are helping us to run the show. And I want to thank again from the NITC Healthcare Community, like Health Center team, Dr. Madhukumar sir, Dean, Student Welfare, who is the brain behind the show. And the most important people to thank and welcome in the show is the people who are here. The show becomes we conduct a program and we were going around, and I think being the end of the semester, everybody is having a lot of work, but we really appreciate you that you proactively took that step to think about your heart, and you are here. Thanks and welcome all of you. Thank you.
Thank you, ma'am. Now I request Professor Shivaji Chakrabarty, our Honorable Director at NITC, to deliver the presidential address.
Very distinguished guests, the doctors and other senior representatives of Aster MIMS who have come to our campus, my distinguished faculty members, non-faculty members, students, ladies and gentlemen. At the very outset, I would like to express my sincere appreciation to our health center team for organizing this program. These are really the initiatives that we need in our campus, apart from all the other activities that we are doing. And they have started in very good enthusiasm. As Dr. Onu was telling, that we had a program on cancer And very interestingly, I would like to comment, because I was also present on that day. The participation on that day was primarily, I saw very young students. And when I was looking at the audience, I found that the average age has somehow increased today's program. So that may be indicative of the concerns of the people, that when we are a little bit more aged, then we get probably more concerned about that particular organ which keeps us ticking, that is our heart. Well, I cannot talk on heart. I have absolutely no idea how this entire system works. Of course, it works somewhere here, but I don't know how it works. For that, here are the peoples who have come here. What not to eat, this is going to damage this, cholesterol, that, all those sorts of advice. And I don't know which one to take, because in Monday morning I get a message that coconut oil is very good. Then Wednesday evening I get a message, no, that increases the cholesterol, so you should not take. So all this sort of thing we get. It's a totally confusing sort of scenario with this availability of all those technologies. So therefore, we need this sort of forums where actually we can hear from those people who know it best. And therefore we can ask freely questions irrespective of our inhibitions. And for example, I asked them the first question, which was a very, you can say, an embarrassing question. I asked them, okay, forget about everything. Tell me the most important question people will ask. What is the effect of alcohol on the heart? Now that should be explained first, because people will not say that, but that is somewhere there in our mind. That what is the effect of alcohol or not? We all talk about cigarette and this and that. But some people will say that you take a little bit of alcohol, it is very good. Some people will say, okay, no, that will this. And when you talk to these doctors across the table, and they will always say, no, don't touch a single drop of alcohol. So all these advices we get. Now what to do in real life? That is one. Second thing, I was telling my own experience that I went for a health checkup. Today we have all these packages, we go there. So after all the tests, I was sent to a dietitian that with the basis of these results, what I should eat. And when that, he was a very smart person, well dressed and everything. So after he gave me all that recommendation, I asked a very simple question, doctor, why are you spending so much of time? You give one-line recommendation that eat grass only. And he got very angry with me that you are joking. I said, no, what you are recommending is exactly same. I mean, what you are recommending basically is you don't eat anything other than grass. So all these things are there in our lives. Now, that cannot be the case, because I believe personally that nature, whatever nature has designed, that something is there behind that. If it is in my system, it has certain functionalities. Like cholesterol is there in my system. I cannot say that cholesterol is not needed in my system. It's not that. Well, you can talk about the limits. That's always there. If you talk about the blood sugar, it has certain requirement in our system. Again, there will be certain limit. So we can talk about those things, that how to manage, how to not to abuse, all those sort of things. But simply some of the suggestions today we get, right? That probably is not the need of the hour. So when we get these experts, I feel that instead of you listen to me, it's of no use. Listen to them and ask questions. I mean, whatever comes to your mind. Let us see what the doctors say, because here they are not the advice. I mean, not writing prescriptions, so they are not legally bound. So I request that the doctor should also give a free-minded answers instead of, when they write the prescription, there will be some bindings, because I may go to court and challenge that this is not good for this thing. But when we are having an open forum, workshop, seminar, whatever you say, so we can have a free exchange of view that, well, this is not so good, this is maybe having some benefit like all that, and not just simply saying that you do this, you do that, you do that, then it will be only. So on behalf of the Institute, once again welcoming and expressing sincere appreciation to the Aster MIMS team and very senior, some of the cardiology consultants who have come here. So I extend a very warm welcome, and I also, on my personal behalf, I thank you, and I expect that in future also we can have more programs like this one, but we have many other issues in our day-to-day life. So cancer was one, the cardiac issue was one, but there are other issues. Maybe we can have also programs on that, and our health center people, I am pretty sure that they will also come with proposals in the days and years to come. So with this, particularly all the people from NIT who are present here, I also express my sincere appreciation of your time, because I can see from my watch it is almost 6 p.m. it is coming, and it's a very notable attendance. I can see almost full houses full, so that also gives me very warm feeling in my heart. So with this, thank you very much for this.
Thank you, sir. Now I invite Dr. Santi Sarjan, CEO Aster MIMS, to address the gathering. Honorable Director, Professor Shivaji Chakravarti, the Dean, and the dignitaries on the dais, very good evening. I know that there are scholars, there are students, there are researchers, it's a mix of community, so thank you very much for giving us an opportunity to be here. I go back to maybe 20 years, 25 years, back. Some of us dreamt to be in such campuses, and probably we didn't qualify to be there. So being here, I'm indeed very much honored. I listened to Sir for 5 minutes. He told me about mechanics of heart, and I'm like, oh, this is what we miss sometimes, learn about machines, talk about something intellectual. So thank you, sir, for rekindling those thoughts again in me and some of us who came from the healthcare background. The reason why we are here is not to instill fear, but to have a friendly, open dialogue. Maybe by talking to you, you can maybe help save somebody else. Not necessarily your family, you, but somebody else who comes across the knowledge that you gain from here. And also, I really want to promise that healthcare is not something that should be restricted to a hospital and people should come to hospital. Health is in your hands and it should be accessible, and you should be in charge and you should be taking care of yourself rather than a doctor or an institution or somebody else. So we just want to interact with you. We will answer all the questions. It's not very prescriptive. It's very open. So once again, thank you, sir, and the rest of the faculty here for being here. And Dr. Anu, indeed, thank you so much for inviting us to this prestigious institution of national repute. So this is a beginning, this is a relationship, and we really want to be, available to help you wherever we can be of help. So we are a call away. Anytime, please do let us know. We're very happy to be here. Thank you so much.
Thank you, ma'am. Now I request NITC Registrar, Lieutenant Colonel Pankaj Akshan sir, to address the gathering.
Very good evening to all. Honorable Director, CEO of MIMS, Aster MIMS, Dr. Santi Sarjan, doctors present here, and the administrator of MIMS, all our senior faculties, non-faculty students. It's indeed a very good time for us. Few months back, the request came, so we need to have somebody to look after other than the medical part of our health center. So we need to have a faculty in charge for that. So the proposal was made and our Honorable Director approved, and that way Dr. Anu Mary Chago is looking after the health center, guiding the health center, and for others also, it's a link. So it is a very fantastic way it is working now, because all the health center people are doing an excellent job, but they are not able to communicate with others in such events. So the very first event what we conducted here was the Cancer Challenge with the Asianet News, that good participants were there, as our director already told. So this time it's the heart dialogue. So everybody's heart will be start murmuring after some time. So this is an event where the murmuring can be changed into dialogues. So I am sure that with this interaction with the doctors panel of MIMS, we will be able to clear many doubts. So everybody, I feel that when we have some headache or some BP, so everybody worried about what will happen to my heart. So our director already told heart is a very strong instrument, like our pump and down in our heart. It will not that very fast, it will collapse, but there must be some indication. So let us hear from our experienced people, doctors, those who are with the very difficult, they are all engaged. One of the doctor was telling he had just managed to attend some cardiac arrest today. Still he find a time to come and speak to us. So I'm sure with this interaction we can make our murmuring into more dialogues. And let us hear from them, and whatever doubt we all can cooperate, we all can contribute and clear our doubt. And thank you for all the MIMS team to coming and representing us. We are looking forward many such events. Another good thing what I wanted to say here, we are going to have a cashless treatment with the MIMS also. The process is already on. The request has come few months back. So hopefully we will be able to utilize the MIMS facilities to all our faculty, non-faculty and student fraternity of our institute. Thank you. Let us start the next session.
Thank you, sir. Due to her duties called, Dr. Santi Sarjan is leaving now. As a token of our gratitude, we would like to present memento to Dr. Santi Sarjan. I request our Honorable Director to hand over the same.
Wonderful. It is our honor on behalf of my team here, our honor and proud privilege to be here to represent our department in cardiology from Aster MIMS in front of this August gathering at this prestigious institute. The last I was here was during some ragam during my college days when I was in medical college, and the next visit is here. So it's a direct transformation of principles, I guess. Anyway, so the thought process behind what we're going to discuss today, as mentioned by Anu, we wanted to make as interactive as possible. As our respected director said, you're free to ask questions. So we also have a small audience engagement software, so that's why she told you to connect to the internet, which I will just let you know in a short while, once the laptop comes on to our table here. So we had 3 sessions planned. So the first session, what we thought Dr. Sudeep, our senior consultant here, would talk to us on general principles of heart disease, its risk factors, its prevention, most of which what most of us know, but still those controversies, those questions, those areas which need to be tackled. And the second part would be on how to handle a particular cardiac emergency. An emergency is something which can hit us at any point of time, anywhere, any place. How well are we equipped to do it? How well are we equipped to handle this is what we'd like to know. So using any browser, just go to menti.com, menti.com, and they will prompt you to put in this code. And yes, I can see that a lot of people have gotten in. I can see a lot of love pouring in. That's great, fantastic. Okay, so just a sample question. Okay, you're seeing the question on your mobile right now. The weather outside is very freezing, cold, chilly, Hot. Okay, so there's a lot of people answering live. So we can see that 45 people, 47, 48, everybody is getting the right answer. Give a big hand for NIT Calicut. Yes. Great. So that's again just to get the... Okay, now getting to something more, this thing. What scares you the most? Again, on your screen, the options are there. Diabetes, heart attack, cancer or stroke. What do you think scares you the most? So we've got... so I think a lot of people are worried about cancer more than... yes. Yes. So, to give you an insight, so 70 people have logged on their answers and 58% are worried about cancer. A small statistic. Sudden cardiac death accounts for more deaths than all the cancers in the world put together. You know? So that's what's important to know, realize, and what can be done about it, and that's what we want to attack today with our presentation. So there you go. So now you're getting the hang of it. Those people who are getting the hang of it can show the up sign. Okay? Yes. Oh, there is one guy who showed the down sign. Oh no, that's a tragedy. Oh, there are people. That's a big tragedy. Anyway, okay, now I invite Dr.Sudeep Koshy, who's going to start off his first talk of the day. And let's see, Dr. Sudeep.
So my topic is prevention and proactive management of heart disease. Now the first thing is, what is coronary heart disease? We have talked about sudden cardiac arrest, a lot of things. What do you mean by coronary heart disease? Any idea about that? Okay, so this is a heart, okay? This is the heart, and I've just simplified. This is the left ventricle, the pump which pumps blood into all parts of our body throughout a lifetime, tirelessly without resting. Okay, and this is the aorta, the main branch from the left ventricle, which supplies blood to all the parts of the body. Every house should take care of itself first, and then only you can take care of other people, right? So the heart has to take care of itself. So the first three branches, this is the right coronary artery, and this is the left main coronary artery, this is the left circumflex and the left anterior distal. Two arteries on the left side and one artery on the right side. These are the in-house arteries which supply the heart muscle. Okay, and what is a coronary heart disease? When the plaques deposit on these inside of these arteries and it gets blocked. It gets narrowed initially. If it gets narrowed initially, when the heart has to beat faster, there is no enough blood supplying the wall of the muscle. So you get pain. That is, you get angina on walking. That's not exactly a heart attack. A heart attack is, an acute heart attack is when, or acute myocardial infarction is when one of these arteries gets blocked suddenly. That's when a plaque, which is already there, ruptures or breaks away, and the blood mixes with this cholesterogenic material inside the plaque and forms a clot and shuts off the blood supply to this part of the heart. That's when you have a myocardial infarction, when this pump fails acutely. So the heart is a healthy pump, it will pump everywhere, tirelessly working, but if it doesn't get its food, it fails. And that's an emergency. That you have to open that artery. We will come to that in the further talks. I just want to give you an overview of what is coronary disease. And that is heart attack. And people can even have sudden cardiac death because when a larger portion of the heart becomes non-functional, there can be pump failure, and there can be arrhythmia, or the heart can fibrillate or run fast and not able to give blood to the other parts of the body. Then it obviously will fall down, right? So this is basically coronary heart disease. Now, there are three groups of people seated anywhere, especially sitting here. The first group is the young people or people who are very healthy, who have no issues at all. Absolutely. The honeymooners. Absolutely, no problem. The second group of people, unknown to them, are people who are the verge of a catastrophe. You don't know. You might have a catastrophe tomorrow. We don't know. My wife said I scare her a lot. but this is not about scaring you. Some things you have to be aware, because you can prevent certain things. And the third group of people who have already had a heart attack or had a heart disease and who are under treatment. So there are three groups of people. Now, what is this? Way back in 1980, when I was a 6-year-old, there was a horror movie which was released called The Alligator. I don't know how many of you have seen it. So it's a horror movie, and we were so scared seeing that. The story is that a little girl gets a small lizard-like thing, and she takes it home as a pet. And the father, he doesn't like it. So what he does, he just flushes out the lizard-like thing in the toilet. 15 years pass by, and then this fellow is in the sewage, down in the gutters, and he becomes big, eating some mutated stuff and all, and becomes a huge alligator, and comes and destroys the city and all those things. So this is the picture of that. So the small little lizard-like thing has become a monster. So what are the beasts in our basement? So there, most of us have beasts in the basement. We won't know about it now, but if left unchecked, it can become monsters, right? There are some things which you can modify, some things which you cannot modify. You cannot choose your parents, right? You cannot choose your parents. If you're born in a family that has coronary heart disease, you're at risk. That's a non-modifiable risk factor. Same way, you cannot choose to be born as a male or female. Now you can change and all, those lot of things are there. But you cannot be choosing that. So these are non-modifiable risk factors. Then there's some modifiable risk factors. Diabetes. How many of us think that if you check your blood sugar, fasting blood sugar, it is around 80, 90, and everything is okay? Many of us think that it is okay, but it's not okay. There is something called the honeymoon period, where your blood sugar will be normal, but your insulin levels will be very high. Your insulin levels will be very high. That is, I'll just liken it to a car. Suppose you have a car with 5 gears, and you're driving it in first gear, put in first gear, and you accelerate to 80 kilometers per hour, and you don't change the gear, and you go to a place 80 kilometers every. What will happen to the car? It will break down. The engine will break down. Is the car moving? Yes. Is there petrol? Yes. But the engine is getting damaged. So, if you are obese, if you are into eating sweet, foods, excess carbohydrates, you're obese, and you feel your sugars are okay, what is happening is your pancreas is getting, the islet cells are getting burnt out, okay? And you'll get into the diabetes phase very soon. Previously, people were very healthy and they used to walk. My grandfather used to walk 20 kilometers to the school. Now my kids, they just get into the car, AC car, and they just go to the school, and they don't play at all. People had to push kids to come. They had to be dragged inside in the evenings, during our times. Now the kids have to be pushed out. That is a difference. Previously, diabetes, my grandmother got diabetes when she was 65, 70. My mother got it when she was 45. My aunt got it when she was 33. Now, children, 14 years, 12 years are getting type 2 diabetes. Not the type 1 diabetes where you don't have insulin from birth, but the other type of diabetes. And this is the beast in the basement. This is the alligator which we flush down the toilet. If you don't check it, it will grow to be a monster. So that's for diabetes. Smoking. Smoking is another thing. I don't think so there would be any controversy about smoking, because everybody would agree that smoking causes a problem. It causes a lot of problems. What you said about cancer, a lot of cancers. But heart disease, yes, it damages the inner lining of the blood vessel. And also it causes the blood to clot more. If you take a smoke, some people say that, I don't smoke a lot. That's true. If you smoke a lot, you have more problems. But even if you smoke one cigarette, okay, the next few hours, your chance of getting a heart attack because of the clot is very, very high. And last but not the least, physical inactivity. They say that sitting is the new smoking. That's a new slogan. I mean, you sit more, It's like you smoke 5 cigarettes. It applies to us, and probably it applies to you also. Because as research scholars and scientists and professionals, we tend to work more sitting. And physical activity is so important that you should have at least 30 minutes of physical activity a day, at least 5 days a week. Okay? What I've just said is just the tip of the iceberg. This is the proverbial tip of the iceberg, but the whole problem is down, just like what I said, beast in the basement. Now, this is the second thing what I wanted to emphasize. Lot of people, in my practice, I'm extremely sad to notice that people don't realize sometimes that they are having a heart attack. Okay? Everybody knows heart attack means you have left-sided chest pain, sometimes radiating to the neck, radiating to the shoulders, left hands. Okay? We know that. But there are some other signs which you should be you should be aware of. What is a silent heart attack? Silent heart attack is when you're not aware of the real pain of the heart attack. It can happen in diabetic patients because the diabetes damages the nerves, which cause you to know about the pain. That is one thing. Second thing, some people have a higher pain threshold. I have it in my own family. My eldest daughter, how much ever you poke, my 2 daughters in fact, how much ever you poke them, the children will cry. My daughters, they cry. My son runs away when she sees a syringe. But my daughters, they'll just give their hand. And how much of time you can poke, you can poke. That means there is a difference in the pain threshold in people. Some people ignore it. Some people, magnify the pain. So, any feeling of difference from the normal, please don't brush it away as some gas problem or something. Because you always hear people say, I had some gas problem, I took some tablet. There is no harm. I heard that NITC has an ECG, right? Okay. There is no harm in taking an ECG if you have a doubt. So anything which is abnormal, I'm not talking that every day you should run to the hospital and take an ECG. No, you should not be paranoid. But if you will know there is something different from the normal. That means you're having unusual tiredness, sweating, no pain, sweating, extreme fatigue, you're tired, you can't even get up. Then you should think that there is some problem. Please rule out a heart problem. So you have to run. Now, I want to talk about the myths. The first myth is gas. Every time, when I was in Vellore also, every other patient will come and say, gas. In Calicut also, gas. Every patient will say, I had gas. People with massive heart attacks also said, I had gas. So, everything here is not gas. And I'm talking about educated people also. I'm talking about even about doctors, because they don't want to accept that they have a disease, right? Because they treat people. Okay, the second myth is, if you have a problem, I still remember in 1980s, early 80s, when the great Kishore Kumar died. You remember Kishore Kumar, right? The senior people will know about him. He had a pain in the morning, he will not believe it. He had pain for 4 hours. A famous man, great man, but he would not go to the hospital. He said, he told his wife, I will prove that I don't have. So he began to shift the sofa, do exercise. So the myth here is, if you have a problem, exercise and see whether it will go away. Don't do it. You should never exercise. What you should do is just relax and call for help. That's all. You should never check yourself whether you have heart disease by exercising. In case you have heart disease, that will be the benefit. You should not do that. Once again, I'm telling you, I'm not trying to scare you, but these are common mistakes which even educated people do. Just like what happened to Kishore Kumar. Now, there is another group of people who have something called cardiac neurosis. You're so afraid of things. You don't eat anything. Yeah? As respected director said, no, what God has given, you don't use it at all. You feel that everything is bad. And so you go to that extreme, no? Your life is miserable. You might live for another 50 years, but you make your life and your wife's life and everybody else around life miserable. That is also not right way to live. That's called cardiac neurosis. And the other end of the other spectrum is carefree attitude. You don't care. Anyway, I'm going to die. I tell these people, very few people are lucky to just fall off and die. Many people will have a heart attack, They will have, the pump failure, you have breathlessness, you cannot do your daily routines. Why you want to go through all those things, right? Okay? If you have to go through, fine, but why you have to invite that? So, you should not have a carefree attitude like that. You should treat it with due respect, in moderation. Now, what happens after a heart attack? Now, this is another area which we have to see. When you have a heart attack, you are on antiplatelets, where blood thinning agents like aspirin, clopidogrel, and cholesterol lowering agents. It is not only to lower the cholesterol, it is to decrease the plaque, cholesterol in the plaque inside the vessel. So even if the cholesterol is normal, you'll have to take medicines. So these are all questions. Okay? And then intervention. Suppose an artery gets blocked suddenly, you open it immediately because you save the muscle from damage. So that is important. But if you have pain while walking and you do a TMT, you see a block, you don't have to do it immediately. You can always go back and come back later. If it is a main artery supplying a large area with a more than 80% block, then only you have to intervene. Otherwise, it's all medicines and lifestyle modification. And finally, last but not the least, lifestyle modification. Once you have a stent, once you have a bypass, some people feel that's the end of the story. I'm treated, I'm well, I go back to my old life. That's not so. Because your treatment starts with the intervention and continues. Because intervention is just a mechanical removal of the block, either via bypass or angioplasty, whatever it is. But the whole treatment is medical therapy and lifestyle modification. Okay? So, we have a lot of other topics which we'll discuss during a question and answer session, like alcohol. Alcohol, it's empty calories, there's no much use of it, but you can't, as Sir said, you can't just advise people go take alcohol because they'll go the other way. Okay, so everything in little moderation is okay, but I would personally, as he said, in my office, I would not tell people please take alcohol in moderation. I can't tell you. Fine, okay, and even cholesterol. There's a lot of confusion about cholesterol now, about the dietary guidelines now. What they say now is cholesterol in the purest form, okay, does not add to our body cholesterol. That means something like boiled egg or something like that, yolk. Okay, that's okay. But the problem is, man-made things are okay, and God-made things are okay, man-made things are not alright. Sometimes you fry it, you do things which will change the chemical composition of that, and that's harmful. We'll get into that later. So, I just want to add the takeaway points. Take care of the beast in the basement. We've had a lot of people, even sitting here, people here know about certain instances where the beast in the basement was not taken care of, and finally we ended up in catastrophe. I'm not only talking about myocardial infarction, heart attack. There are other complications of diabetes. There are other complications of smoking. So take care of the beast in the basement. This is my message to you, okay? Because today it will be all right, everything will be all right. One day that alligator will come out. It should not happen. We should be aware. Intervention is not enough. That is my second point. That means you do an angioplasty, you do a bypass, that's not enough. The main treatment is and always will be your medical therapy and your lifestyle modification, which includes your risk factor reduction like diabetes and hypertension, and your physical activity, and your stopping of smoking and all those other things. And finally, you have to identify a heart attack. A heart attack is when you are having a silent attack, anything abnormal, you should take note. Anything abnormal, you should take note. Otherwise, it'll be a problem, and you will end up. One ECG, it can save a lot of trouble. And also, you should be aware of identifying a cardiac arrest, sudden cardiac arrest. You should be aware. Okay. So I just want to sum up with these points, and I hope I have done some justice to your, what you have in your mind, and have thrown some light on some things. Thank you very much.